Good day, I'm Sadini Gunasinghe from Group 25 and today I'm going to demonstrate post-operative care for patient who had elective neck lipoma surgery. So first, let's talk about what is lipoma. Lipomas are soft, fatty lumps that grow on your skin. They are harmless and they do not usually need any treatment. It is also not cancerous, so that's why it is an elective procedure which will be carried out for the patient. Elective surgery or elective procedure is a surgery that is scheduled in advance because it does not involve a medical emergency. So the date of the surgery is pre-planned and the person will usually come one day before the surgery and admitted in the hospital. The whole process of the surgery is already pre-planned. So firstly, the post-operative care of the patient starts immediately after the surgery, where the patient will be transported into the post-anesthetic care unit, and in this unit, the patient will be taken to check the consciousness, and if they didn't regain their consciousness, they will again come back and check it about in 15 minutes. Once the patient has regained consciousness, we can start our first visit, which they will receive in the PAU unit. As an example, if the surgery had occurred in 7 p.m. or 8 p.m., the patient will probably remain in the PAU for 1 to 2 hours, maybe, before the patient is transported into the private ward. First, let's begin with what you'll be checking when the patient regains his consciousness. So, when they regain their consciousness, first we have to make sure that they are in alert. For this, we can ask some basic questions from them, such as, hello sir, can you hear me? And you can ask for their name, if they know where they are, how they feel at the moment. From asking these questions, we can make sure the patient's alertness. Then we can check for the patient's vital signs such as pulse, heart rate, respiratory rate, blood pressure, body temperature, and so on. It's important to remember that for the first 2 or 3 visits can be done between every 15 minutes. So if the patient's condition is normal in your first visit, time for the second visit can be doubled. As an example, if you come for the second visit in 5 minutes after the first visit, and if the patient's condition is normal, you can double the time duration between the second to third visit. It means you can come for the third visit in 30 minutes instead of in 15. And for the fourth visit, you can come after 1 hour, and so on. So it's very important to keep the alert on vital signs of the patients, and the changes in vital signs can indicate the post-operative shock due to the bleeding or dehydration, inflammation, or post-operative infections. So it's very important to take the records of these vital signs regularly and keep eye on the patient as well. In case of post-operative shock, the patient might be confused and his skin might be clear and pale. So it's important to pay attention to these signs as well. Nowadays, with the help of technology, the digital monitors can help medical professionals to keep an eye on the vital signs of these patients. When considering the temperature of the post-operative patient, 37 degrees are normal for them, even though it may be a little bit high for the normal patients. But if their temperature elevates to 39 Celsius or 38 Celsius, we must keep an eye on them and must be reported as soon as possible. Skin color of the patients must be also recorded. It could be pale, normal, or cyanotic blue as well. Blue skin usually indicates cyanosis or lack of oxygen. Pale skin may be a sign of internal bleeding. So these signs must be recorded very carefully as well. So the next part of the post-operative patient care is checking the site of the surgery. The site must be checked for the hemorrhage and dressing state as an information. For this, we can check for any color changes in this area. Redness and local heat also could be the signs of inflammation. Additionally, bone drainage NG tube loss and urine output of the patient can be checked as well.